In this episode, we dive into the ongoing debate between two leading allied health professions, and I use that term debate loosely. We want to explore this. Physio and osteo. We'll be joined by experienced practitioners who'll share their insights on the best approaches to rehab, performance, and overall health. We'll explore the key differences and similarities between these professions, uncovering the unique benefits, because it's much talked about, and what they bring to the table, and why, in many cases, a combined approach can yield the best results. With many top sporting teams now employing both an osteo and a physio, we'll examine why this combination is so effective for injury management, rehab, and peak performance. Joining me as always, once again, Nick Jarman, a highly experienced physio with over 20 years in the field, that's 2 decades, alongside osteo, Will Paatsch, head osteo at Geelong Sports Medicine Centre, and Newtown Chilwell Footy Club. Welcome to you both, boys. We want to rip into this one. Will, welcome to you. You're new to the microphone, mate. It's great to have you.
Yeah, it's good to be here.
Yeah, and I did say earlier, we use that term loosely with a debate. Osteo, physio, but it's such a common question. What's the difference between the two?
That is probably the $1 million question. And Patchy gets it all the time. I get it all the time. The admin staff get it all the time. What is the actual difference? And trying to differentiate between the two of them, it's hard.
Yeah.
It's a real difficult. It's like saying a remedial masseuse versus a myotherapist and that side of things. It's a fascinating topic. In a nutshell, there's not a real great difference. We're very, very similar.
Yep.
Both been around for probably the same sort of time frame in regards to the historical, how it started. But to get, as I said, it's confusing now to try and work out what is osteo, what is physio, what does what does who likes what.
Yeah.
And the hardest thing for us is for us to explain it, Patchy to explain it, and the admin staff of any allied health clinic, when you've got two modalities there for treatments, it's hard to digest and explain it pretty simply. It is tough, but it's similar.
And you get the question a lot, Patchy?
Yeah, I do.
Most days?
Yeah, probably.
Yeah.
People sort of book in whether or not it's with me for the first time or they're just generally curious. They sort of say, what's the difference between physio and osteo? And I suppose the easiest way I try to look at it with them is taking it back to more the uni course, because once you're out at uni, there's so much freedom to go where you want with it, and it very much depends on the clinic you work in. Like, I'm very lucky here as an osteo. We've got the pool, we've got the gym equipment, so I do a lot of that exercise stuff, and comparing that to other osteos maybe a little bit more. But the best way I sort of look at it is university, a lot of the physio course, from my understanding, correct me if I'm wrong here, Nick, but very much exercise rehab based, and they're much stronger in that coming out of uni, whereas osteos, we're probably more hands-on based, musculoskeletal treating that way with hands. But again, that's very much uni, straight out of uni, and then go where you want with that, to be honest.
And it's practitioner.
Yeah.
I know I've pretty much done 20 years of hands-on therapy because I didn't have access to a hydrotherapy pool and I didn't have access to a gym, so it was all hands-on. And as time gone on, dry needling and cupping and that sort of stuff, we adapt. We go and learn courses. But as I said, Patchy's lucky to be having the hydrotherapy suite here, the gym upstairs, having different practitioners to bounce off, I think is important. Some of my patients or some of the clinic's patients come in and try physio, hasn't worked for them. Then they go and try myo, hasn't worked for them. Then they go and try osteo, and it's works for them.
Yep.
So it's a different approach. It's a different skill set. Which is a big factor. But from the physio side of things, as Patchy said, we are exercise-based, evidence-based practice, and it has been for a period of time. But more unis now doing exercise-based, but you still need hands-on physio. Mm-hmm. All right, it's the crux to the same with the osteo side of things. You still need hands-on with exercise to get that common goal for the client, which is same with osteo. You've got to get them right. You've got to get them back playing sport. You've got to get them back to playing. You're working, playing with the kids, whatever it may be. You've got to get that health of that patient right. And that's the crux of it. And how you do that, it's up to the skill set of the practitioner. But physio versus osteo, it is. It's a fascinating subject. So osteo, tell me a bit about the osteo side of things, because that's Privy being a physio for 20 years and now osteo sort of has been creeping in the past little bit of time. It's getting more popular. Tell me about the osteo side of things in regards to the study, the uni, what you can do in regards to different osteo specialties.
Yep.
Tell the crowd out there what how it all started.
Yeah. Well, I got into it straight out of school. I just went in there. But the actual osteo course, the length of it actually depends where you study it. I studied at Victoria University. So the standard across all courses is that you're doing a 3-year undergraduate bachelor. I think it's sort of majoring in that science, osteo specifically. But depending where you do it is then the length of your master's. So you actually can't just do a bachelor and call yourself an osteopath. You have to do a master's. So I was at Vic Uni. We did one for a year and a half. I know that RMIT at that time was 2 years. So they're the only two places in Victoria that do it. And then you've got to go Queensland, I think, for it.
Okay.
Yeah.
Yep.
So what drew you to it? What drew you straight out of school into it?
It was personal experience. I was swimming all my childhood into surf lifesaving, all of that, and through injuries, I just personally found that osteo worked well for me.
Yep.
I also have I hate hospitals, and physios do a lot of placement in hospitals, so I wasn't doing that. But,
Dry needling.
yeah. Well, I actually don't teach you dry needling in the courses. I'm not sure about physio.
We touch on it, but as I said, if you want to be a bit more experienced in some of those different modalities, you go and explore a course or a 2, 3, 4 day course.
Yeah. So doing an external course, which means you can do that as well, and cupping and all that stuff. So you're continually studying. You do the osteo course, but from there you keep going.
Yeah, cool.
Things.
Yeah, it's what Paatsch said, osteo worked for him.
Yep.
Absolutely, and it is patient dependent of what works for them. It's a fascinating thing. Did you try physio when you were getting injured?
Yeah. And again, it was just for me. I like the osteo side of things for me. With swim clubs, with sports teams that I was in, we had physios, we had osteos, and it was just personal preference to be honest.
Yeah.
Absolutely. And pretty much summarise it then.
Yeah. So if I'm a new client and I come in GSMC and I present with, say, I'm a office worker. I stare at my computer all day and I've got neck issues, back issues, all these sorts of things. So nothing physical I've done in terms of an injury itself, but I'm cramped up.
Yep.
I don't know who to see. I just want it fixed. What do I say? How do I present that and say I need to see somebody about this issue? Who's the best person I can talk to?
Tough one.
Yeah.
Is it something, and how often this could roll in?
This happens every hour.
Yeah.
Every hour. Someone will ring up and say, right, the best summary is most of the people that probably ring up here would be regular clients.
Yeah.
Have seen Paatsch before or a physio before, and they sort of go that way. But as you said, if you're a new client, they ring up the reception desk. Which way do you go? And it's a hard one for the girls to decipher. Absolutely. It could be a combination of both. Have you tried physio before or have you tried osteo? That's one of the questions the girls ask. No, I haven't tried either. Well, why don't you try osteo? Because it could be that craniosacral type of injury.
Yeah.
And as Paatsch said, hands-on, both physio, strengthening both osteo and physio, that side of things can work. But I would summarise it to be either one.
I know that here we've all, probably everywhere you work really, but everyone has a different interest as practitioners, so it probably comes down more to that. Like I really like working headaches, neck, spine.
Yep.
So if someone was sort of saying, a bit stiff in the neck, might be pushed more towards me, but likewise, knee injuries, ACL injuries, that's probably not my forte.
Yep.
Yes, you can do it, but it's not something that I sort of pride myself on really doing well.
Yeah. Do you cross over much internally?
100%.
Yep.
Yeah, we do PD in here. We get the physios, the exercise scientists, the exercise physiologist around the PD, and we learn off each other. And the beauty about this place is that we walking down the corridor, we see Paatsch, and Paatsch's mate, I've got an injured worker, it's Ben. He's seen a physio for a few times for his neck. He's not responding to physio modality. He's done the exercise, done the hands-on, not responding. Can you see him? And Paatsch will say, what have you done? And we've done A, B, C, and D. Gives Paatsch a bit of a handover in the corridor. All right, we'll get that patient to go and see Paatsch. And whatever Paatsch does in the treatment modalities could work, may not work. Paatsch might need to refer off to something else, a doctor or a myotherapist. So it works well here at Geelong Sports Medicine Centre that we've got a big team, a diverse team, a different skill set. And we do have a good crossover.
Yep, and a big hallway so you can have those little meetings. That's great. Good work. In terms of sort of private life or personal life with you guys, so playing footy, Paatsch, whatever it looks like, Nick obviously out in the community, when people find out what you do, is it really common that they sort of go to these directions and say, hey, I've had this. What do you think? Is that something you guys get a lot? The pub?
Supermarket, post office. Yeah, you do.
Yeah. Most people sort of go, when I say I'm an osteo, they go, what's that?
And that's what
growing.
this podcast is about. What is
Yeah.
osteo? And then we'll try and break it down, but I reckon we're not going to get a good result at the end because it's going to be simmer.
Yep.
But we'll try and keep going.
Yeah, definitely. But yeah, very much the same. Like people go, oh, got a sore back. What can you do for me? It's like you can come into the clinic and I'll see it in Napa.
Yeah, make a call.
Yeah.
But I think the key takeaway, what I'm sort of picking up from this with you guys now, is the fact that you've got everything under the one roof. So, yes, you might be a little bit skeptical in who you need to talk to. Yes, you know you're sore. You've got to do something about it. But the ability to cross over and keep, for me, just thinking out loud, keeping the patient front of mind and number one.
Yep.
So what can we do for you? If this isn't working, let's pull another lever, and we've got the ability to be able to do that right here. So that's a good little combination, I think, that's working beautifully.
Yeah, absolutely. And to go back a step, probably when I first started in 2004, my point of view, well, osteo wasn't huge back then, but now it's getting bigger and bigger and bigger, and more allied health clinics are employing osteos and myos and physios for that same sort of reason. But now it's becoming more of a team rather than a competitor, if that makes sense. Right? Oh, don't go see an osteo. They're our competitor, but now we're actually employing different modalities to help that patient. And as you said, the customer service and the patient is at the front of every business. And if that patient can get right, got fixed by osteo, awesome. Where'd you get fixed at? Geelong Sports Medicine Centre, Will Paatsch.
Yep.
Will. So it's a good lever to pull on. Yep. Absolutely. And as we always go back to, they're a similarity. They're hands-on. They're both exercise prescription. Physio probably a bit more exercise subscription, depending on the practitioner and where you've been trained.
Yeah, absolutely.
And I mentioned it in the intro too, Will, but many sporting teams are now employing both.
Yeah.
You see value in both at a footy club?
I do, yeah. I think everyone sort of brings different strengths to the team. I'm working locally at Newtown Footy Club. It's just me, so I don't really have that sort of big experience, I suppose, that some others might have, where there's lots of different people to bounce off. But I do have here, and even like sporting clubs, looking outside of sporting clubs, I've always worked with physios and worked with other practitioners, and I think that's best, and that's why I do it. But yeah, I know I've got some friends that are working in sort of elite level clubs as osteos with physios and vice versa. So yeah, they all think that's really beneficial too.
Yeah, cool. What about your goals, Paatsch? Well, we've got you. You enjoy what you're doing, obviously. We've spoken about that at length, but what do you want to achieve in terms of where you can go and what you want to do?
Oh,
sorry, mate, on the spot.
No, that's all right. I don't know. I think I just quite like the learning aspect of it. So I try to make sure I do a decent sort of study course. We've got our personal development requirements every year as part of the osteo board and governor. Yep. But I just like the learning aspect. Just as long as I'm learning, I'm doing the right thing and I'm enjoying it. And if I'm not learning, I'll look elsewhere, look for a different job.
He's going well, Nick.
He's going well. Pain's probably the biggest thing we see here. So we're going back into that side of realm of between osteo and physio. Acute pain, physio, osteo, physio, both sort of hand in hand.
Yeah, hand in
hand.
hand.
Yeah.
No, that's all right.
But we do get thrown under the bus with these questions. Like, if someone comes in with a headache or those acute injuries that present on the Saturday, ring here on a Monday, who do I see? So a pain's a big thing for osteo, and how do they manage that?
Yeah. See lots of acute stuff. I suppose again, it sort of comes down to what area and what interests. And you can very much tailor your treatment to the person. If they're coming in with acute pain, your probably priority is to try and give them a bit of pain relief, even if it's not something that's sort of long-term rehab stuff, and it is a bit of a lighter sort of treatment. If they're walking out here and going, they listen to me, you've done your job really. Yep. So if you can help them, regardless of how you need to tailor that treatment, that's sort of the goal. And then if they get that pain relief, they're going to come back. You're going to be able to then work through that sort of chronic prevention management, that sort of thing, which is a big part of it too, is all the sort of prevention education's massive across both. And
yep.
Mm-hmm.
Yeah.
And what's sort of some of the modalities that osteos use to address acute pain?
I do a lot of soft tissue therapies, so whether or not that is massage, trigger points, technique that I use quite a lot's muscle energy techniques, which is probably more of an osteo technique from my experience. We can use sort of the HVLA, or as everyone knows it, the cracking side of things too, but
Break that one down.
I love that.
Yeah.
Is it good for you? You do it, so it's got to be good for you.
Yeah, obviously not everything's good for everyone.
Yeah.
But
Good way to put it.
it's very much person dependent. So it's probably more about the history of someone. So if you're clearing their history, making sure there's nothing that's standing out that's negative or harmful to them, yes, done by a person that knows how to do it, it's perfectly safe. If you're not doing a history, if there's things that stand out, you're probably not going to do it. So things like weak bone, fragile bone, previous breaks and surgeries in that area. People might do it. I don't. That's not an area that I'm going to go into.
Cracking is a big area of osteo.
Yeah,
Cracking,
can be
manipulation.
Yeah, that's probably one of the differences is we do learn a lot of that. So at uni, whereas physios learn a little bit of it. But yeah, again, it's person dependent, but it's something that I do find beneficial to a certain sort of person.
And prime example, I don't do a lot of manipulation.
Yeah.
Haven't been trained in it. Not part of my skill set. So I refer off to Paatsch for anyone that I think that might need a manipulation or a crack. And that's where that team environment works. That if you can't get that patient right from your own skill set, refer off.
Yeah.
That's a good difference.
Yeah. It's almost like this is what I want to talk to you guys about, but having that tag of, yes, we're a sports medicine centre, but a lot of people just assume that physio is for sports only.
Physio-wise?
Physio-wise.
Absolutely not. No. We've you'll see some of our clientele at certain parts of the day. They are an elderly athlete.
Yep.
They've come in from the garden. They've lifted their grandchild. They've got the osteoarthritic knees. Physio is a global from young to old. You can I hate that word.
You've got it, mate.
Yeah, specify in different areas. You can go from geriatric physio right through to pediatric physio and anything in between. So there's sports, like as we on the other podcast we're talking about Rich Citron, about the elite level sports physio. That's a totally different physio to a general physio, and you can diversify in any sort of area. But we physios in a whole treat anything. Osteos treat anything.
Yeah, absolutely.
So you're best friends, you guys, aren't you? Physios and osteos, you're intertwined under the one roof.
We are, and it's getting more and more intertwined because you want that patient outcome.
Yeah.
Whereas 20 years ago, no, I'm not going to see an osteo. You're taking away my patient, if that makes sense. And you're not ego-driven, but it's more, that's my patient. I'm going to fix him. If I can't fix him, nobody can fix him.
Yep.
And that has done a full 360 in the last 15, 18 years.
Yeah. So a good combination of both.
Yep.
Patient always front of mind.
Yep.
Get the result.
Yep.
Work together. Can't go wrong.
Can't go wrong.
That's a
Love it, guys. Hey, thanks, Will. Great chat. Really
right.
appreciate it.
Thank you.
Thanks, Nick. Fantastic as always.
Thanks, Ben.
All over it.
Bye.